to see the treatment of the hypertension. And what protocol are we using? This is strictly based on the European Society, of the cardiology guidelines. So based on this, we look at the treatment of the hypertension. So let's look at some indications as well as the treatment of choice. So firstly, we need to know the indication. So under the indication, there is the hypertension alone. So in terms of hypertension alone, and the hypertension along with the diabetes, or with the cerebrovascular diseases. So in such cases, what is a initial TOC, that is a treatment of choice. So this includes, there is the ACE inhibitors, there is the ARBs, as well as along with this there is CCB, that is the calcium channel blockers as well as diuretics. So in short, it is known as the A plus C or A plus D. So that is AC inhibitors or the ARB along with the CCB or the diuretics. Next, we will look at indication which includes the coronary artery disease. So hypertension along with coronary artery disease. So here the initial treatment of choice. This includes, there is a AC inhibitors or ARBs, and this is nothing but along with the beta blockers. This is along with the beta blockers or the CCB. So in short, it is the A plus B or A plus C. So this is one aspect of it. So this can be done, or there can be the beta blockers. So we can give beta blockers along with the diuretics, and this is nothing but B plus D. Or we can administer CCB plus the diuretic, CCB plus the diuretic or the beta blocker. So this implies C plus D or C plus B. So this was the hypertension with the CAD, that is the coronary artery disease. Next, we look at the hypertension. This will be in respect to the CKD. So if a patient has CKD, there is ACE inhibitors or ARBs, and this is given along with the CCBs, the calcium channel blockers or the diuretics, and there is AC plus A plus C or A plus D. So this is about the hypertension with the chronic kidney disease. Next, we'll move on to the hypertension. So the hypertension with the heart failure and reduced ejection fraction. Hypertension with heart failure and reduced ejection fraction. So here there is ACE, ARB along with the diuretics. So plus diuretics plus beta blockers. So there are a lot of things involved here. So there is AC, ARBs, diuretics and the beta blockers. So in short, we can write it as A plus D plus B. Next comes a concept in case of pregnancy, what is done. So in terms of the pregnancy, what is administered is the labetalol. So there is labetalol, there is nifedipine, as well as there is a methyl dopa. So this was about the treatment of hypertension complying to the European Society of Cardiology guidelines. So to learn and grow daily like this, please do subscribe.